We know that in every setting there are safe providers and there are providers that are not safe. So how do you know if you're getting a provider that is safe, and how do you know what questions to ask and what to pay attention to? So one of the first things I would invite you to pay attention to is, are you seen and heard? Are your concerns seen and heard with the provider that you have? When you bring up something that's concerning to you, is it consistently brushed off or is it investigated? Our job as providers is to see you and hear you, and that is part of what keeps you safe. And if things are normalized that aren't actually normal, or if investigation and follow-up questions are not consistently happening, that would be something to pay attention to. So if you bring up a concern, does your provider ask follow-up questions to try to rule out that this is something more concerning? Do they do testing, ultrasounds, blood work, anything to kind of follow up and see what may be going on for you or your concern? In the birth scene, that would look like following up with, vitals, maybe a cervical exam, a check of some sort to see if what's going on is normal or if there are concerns happening. The other thing I think is that a good practitioner, especially in midwifery care, is paying attention to two things. They're using both what they can observe in their intuition, and they're using the tools that we have accessible to us to confirm what they're seeing and thinking. So, in a hospital setting, for example, there can be an over-reliance on those tools where maybe somebody is down the hall watching a screen and they're only getting information based off of those vitals in isolation. And sometimes that can lead to overreactions. On the other side of that, if somebody is only leaning on their observation and their intuition and not ever verifying those things with the tools that we have at hand, things can be missed and harm can be done. So in our setting at home, if we're seeing something that's concerning or we're seeing something that's raising a little bit of a question, always following up those things with taking vitals, confirming what's going on is key. I might see something and think, this seems okay, but I'm going to confirm and make sure with vitals that this is not something more concerning that's going on. So using both tools that we have accessible is so important in keeping a family safe.